about fifth, and even higher numbers in BC reported suicidal thoughts, felt unfairly treated, damage to personal relationships, family, friends, community, you name it. And over 40% intended to leave their jobs.
I just have to jump in with a question because those numbers are horrible. That's horrific. Have you ever?
I'm sorry?
Those numbers are horrific. And this is...
Yes.
You almost don't know what to say about this when you start seeing numbers like that. Have you ever, in your career, seen anything like this?
Well, I haven't, but I wasn't doing this kind of research, so I don't know. It could have happened in other things with other, I don't know, vaccination initiatives, mandates, changes in the workplace. I wouldn't know. The scope and reach of this policy, I think that anybody would agree, is unprecedented. So whatever happens at a smaller scale, if you want to, my personal, just anecdotal, evidence would be, when I was in medical practice back in Argentina in my former life, I never experienced anything of the sort. Nobody ever came into my office and said, you have to prescribe this or you cannot prescribe that, even against your best clinical judgment, because otherwise you're out of here. I never had that experience. Right. Now, perhaps I was naive. There's a lot of things, but I never thought I would do something that, in my clinical judgment, harmed my patients, and I didn't. So I've never seen anything like that. As I said, I have nothing to compare it with.
Okay, please continue with the data.
So these are some of the key findings. You see the vaccination status overwhelmingly, and I have things that can speculate about this. Employment, mass of terminated healthcare workers. We're trying to get some data to actually document how many healthcare workers were lost to the, in Canada, were lost to this policy. And not just terminated, but for instance, early retirements, changes in profession, all kinds of things. The mental health impact, and again, this is a bit, I don't quite like this because this is sort of medicalizing something that I think is simply unethical, immoral, right? But people like to talk about the mental health impact, suicidal thoughts. This is completely preventable, right? Mental health problems. Then, of course, personal life, professional consequences, disruption of your identity as a health professional, etc. Some of the most concerning things that we collected in terms of information were their observations about increased patient harms, right? For instance, differential treatment of patients who were unvaccinated for whatever reason, right? It's their right, informed consent. However, they're treated very poorly, even in insulting ways. So some of the descriptions were, really harrowing. And then these changes after the vaccine rollout, and many of the protocols that, you have protocols, you don't take them as, sort of biblical commands, but some guidelines to proper behavior in the health professions. And those were kind of thrown out the window. Like you have to obtain informed consent from your patients. You cannot force them to do something that they are in principle, very opposed to doing, right? You can't ram over them, etc. So all those things, as these workers reported, were thrown out the window. And there were a fair number. So even if it's a minority, it doesn't matter. It's like an ethical issue, right? It's not a battle of, who's the majority, right? The mob rule. So that's another one. Then I said, okay, am I really seeing this, or is it my own bias, right? Against forcing people against a medical intervention that they don't want, and in my opinion, they don't need.